Hello, good evening. My name is Lindsay Ebot, and today, for the purpose of my healthcare laws and compliance class for Pima Medical Institute, I will be discussing a case of HIPAA violation. What is HIPAA? HIPAA is a Health Insurance Portability Accountability Act. HIPAA is United States legislation that provides data privacy and security provisions for safeguarding medical information. The goals of HIPAA are to protect health insurance coverage for workers and their families when they change or lose their jobs, and to protect health data integrity, confidentiality, and availability. Its purpose is to help people carry their health insurance from one company to the next, as well as streamline the movement of medical records from one health institution to another. In addition, HIPAA created a system to recognize and enforce the rights of patients to protect the privacy of their medical records. All right, now that you know a little bit about HIPAA, what is the case that is being discussed? The case that is being discussed today is that of Dr. Barry Helfmann and the Shores Hills Associates Psychology Group. How did they violate HIPAA? Well, they sent unpaid medical bills to collections which contained patient health information, or PHI for short. I chose this case because you don't often hear about HIPAA being violated in this sense. I understand that if we as a patient choose not to pay our medical bills, or we are unable to pay our medical bills, that those bills are to be sent to a collection agency. But do you ever think that the collection agency would have access to all your medical information, including your diagnosis and treatment? Not very often. Now for the details of this case. So sending actual patient bills to a collections firms can violate HIPAA laws. This was illustrated painfully in the case of patient privacy advocate Dr. Barry Helfmann, president-elect of the American Group Psychotherapy Association. According to case files, Dr. Helfmann's employees regularly forward past due bills, patient bills, to collections firms. So, what exactly is the problem? The problem is that these bills contain protected information like CPT codes, which can reveal patient diagnosis. For these violations, the administrative law judge recommended that Helfmann pay a fine and share the state's investigative cost. Helfmann also had his license suspended for 2 years. During the first year of suspension, Helfmann was not allowed to practice his medicine. During the second year, he was allowed to practice, but under supervision. In addition, Helfmann also had to pay $10,000 in civil penalties. Short Hills Associates employees were required to take a course in ethics. Okay. In total, there were 24 cases filed by Short Hills Associates from 2010 to 2014 over unpaid bills, which contained patients' names, diagnosis, and treatments. With Dr. Helfmann being the compliance HIPAA officer, he should have ensured that the patients were made aware that if they had unpaid medical bills, that their information would be sent to collections firms. Each patient should have signed a consent form when they became a patient at the organization. This could okay that the information, including name, phone, and address, would be sent to these firms. So I agree. A consent form should be filled out when it comes to sending out patient information to third parties. He, in the collections agencies are a third party company. They are not with the doctor's office. So, with that being said, a consent form should be always signed by a patient to send information, their personal information, to this third party company. It goes the same, such as uh, I work I work in scheduling mammograms, for instance. We'll use this as an example. So when I talk to a facility and they ask me where the patient last went for their mammogram, and the patient has told me, or the patient is telling them, oh, well, I went to Memorial Hospital for my last mammogram, and they're trying to schedule at Penrose Hospital for their mammogram this year. The facility in turn tells this patient, well, when you come in, we're going to have you sign a consent form, which gives us the right to access your information from Memorial Hospital. This is known as a release form. So, in turn, even to send this information of the patients to a collections agency, a release form or a consent form should be filled out. So that is my opinion and my personal opinion on this case here. Dr. Helfmann could have still had his license, not suspended for 2 years, if he would have followed the simple fact of having his patient when they came on board and decided to become an established patient with him in signing a consent form that says, you know, if you choose not to pay your medical bills or your bills go unpaid, we have permission to release your information, such as your name and your date of birth and your phone number and your address, to one of these collection agencies. So if the patient signs that, they're okay with having that information released. So in turn, the facility or the healthcare organization doesn't get sued. And some of the resources I used to make this video today was PublicaHealth.org, the Medical Journal of HIPAA, and MedPro Disposal, which has 20 cases of HIPAA violation listed. I do want to thank you so much for taking your time and watching this video. I hope that you found this information useful. Have a great day. Thank you so much.